The fact that we're having to pass legislation to prohibit those practices is something that none of us could have ever conceived.
Hotels, offices, hospital overstays, and homeless shelters. All places where children in Maryland's foster care system have been placed by the Department of Human Services. It wasn't until the death of 16-year-old Kanaya Ward and a scathing audit of DHS that an October 2025 directive ordered the agency end the practice. Delegate Mike Griffith, who went through the foster care system as a child himself, introduced Kanaya's law to make those changes permanent.
I know what it's like to be in the foster care system, but I also know what it's like having the adults in the system not make you feel like a priority.
Kanaya died by suicide in a hotel room last September. The DHS investigation places negligence on a contracted firm hired to look after the teenager.
Kanaya was allowed to be in this room with a bottle of over 350 pills of Benadryl.
Griffith's bill is now part of a package he calls the most robust foster care reform legislation the Maryland General Assembly has ever seen, aimed at strengthening safety standards in homes children are sent to. Along with background checks, the legislation prohibits DHS from placing them in unlicensed settings such as hotels and homeless shelters. It would also create an ombudsman to be an independent advocate for children. Now, our Maryland Public Information Act request reveals that from January 2023 to December 2025, 34 youth stayed at youth shelters in Maryland. We're now sharing this number with Delegate Griffith and Maryland Legal Aid, which represents children in the system. As someone who's spearheading this legislation, what do you think of that number?
Well, for me, as many concerns as I've had for basically my entire life around DHS and the social services system, that even shocks me.
It is surprising, and it's really unacceptable.
According to Maryland Legal Aid, children were placed in shelters alongside adults, not just other youth, such as in the traumatizing experience of a 17-year-old girl disclosed to 11 News Investigates.
This teenage girl was sexually assaulted. It did not occur in her home. She went to the hospital, and her parents did not come to retrieve her when it was time for her discharge. Immediately after being released from the hospital, she was placed in a homeless shelter.
Their team had to file an emergency motion, and ultimately, the court allowed the girl to return home. Erica Lamont blames a lack of adequate placements to meet the need, staffing and funding challenges, coordination shortfalls between agencies, and she says when under pressure, inappropriate arrangements often become the easiest option.
There are going to be times when there is an emergency situation and there is no placement available. We need to plan for that now.
We came in knowing that that the state had some real challenges around placement. Having the appropriate placement.
Senior advisor to the DHS Secretary, Stephen Liggett-Creel, says they've been aware of and working on the placement issue long before this administration, and their reform goes beyond what's been reported.
As we realized that, we immediately started to say, let's get a grasp of this, and we understood coming in that there were kids having to utilize these unlicensed settings, hotels, shelters, because we didn't have the right placements for them.
He says to end the practice, DHS has adjusted rates to support providers, created new expectations for those providers that in turn expands capacity, and they've moved to a kin model, increasing placements with family members.
That's really where I see and am excited about how we push that, continue to support that, maintain families, and then build a provider network that can serve the child when they need to and then ultimately achieve that permanency.
Liggett-Creel says there's more work to be done. Lamont says it'll take multi-agency involvement to see a real systemic shift, and at the same time, an individualized approach to each child's unique case.
The front and the foremost are these children, and we should never forget that.
For 11 News Investigates in Baltimore, I'm Tommy Clark.